Hello, welcome to Mental Health for You. My name is Randall Crouch. I'm a licensed mental health counselor, licensed in the state of Florida. I've been practicing mental health counseling since 2005. I cover a variety of issues on this platform and things that I've treated over my 20 years in practice. I am currently retired and I'm not accepting any new patients at this time. I hope you enjoy the lesson that I provide here. This lesson is on sleep hygiene and sleep wellness and how we can have effective sleep every night consistently. All right, let's get started. All right, sleep hygiene. The importance of proper sleep for overall wellness. What is proper sleep? We're going to define that. Proper sleep is the 6 to 8 hours that are required for adults each day. Okay, this is start to finish 6 to 8 hours. It's not I get 2 hours here and I'm gonna get 3 hours there. It's not a breakup of I get 6 to 8 hours over the course of 24 hours. I have a block of time in 6 to 8 hours where I am sleeping, and that is what's key. This needs to be achieved in a way that allows all sleep cycles to process unbroken. I put it better in this slide than I said it. So it happens that way sometimes. All right, sleep cycles are 90 to 120 minutes of sleep each. And you need to complete 4 to 5 sleep cycles. It's very important that we do this for our long-term mental health, but also to help prevent or reduce our risk of neurological illnesses later in life. So if you struggle with sleep issues in your teens and early 20s, you are more likely to have neurological issues in your 60s, 70s, and 80s if you live that long. All right. First sleep cycle is the shortest. It lasts about 90 minutes, and subsequent sleep cycles last between 100 and 120 minutes. All right. The sleep cycles. Stage 1 and 2. Some of the stuff's a little dry, but I'll try to make it a little understandable so you kind of know what's going on. I think stage 1 is kind of funny. Stage 1 sleep cycle is the lightest one. It's where, you know, if you're my age or older, this has happened to you. If you're younger, you've seen your dad or mom or grandma or grandpa do this. So you'll be sitting in your recliner in the living room watching TV, and you shut your eyes for a second and someone comes in and you jerk and they say, "Oh, you were sleeping," and you're like, "No, I wasn't sleeping." You were sleeping. That's stage 1. It's the lightest sleep. We can still kind of hear what's going on. We can sense a presence of someone coming into a room, for example. And I put in here, if a person in this stage is awakened, they may claim they were not asleep. Very, very common. I was just resting my eyes. You get that kind of reaction out of people. I don't know why people do that. I guess maybe they feel ashamed that they fell asleep, or they can't believe they fell asleep, but it happens. One of the nasty things that can happen during this stage is something called hypnagogic hallucinations. And what that is that your brain actually has a dream. You have a dream, but your brain can't differentiate between what is dream and what is reality, and it kind of merges them together, and it makes you think that what you're seeing or hearing or experiencing in that dream is actually happening to you in real life. These can be very terrifying. If you have these consistently, you need to see a sleep specialist. Stage 2 of the sleep cycle is where adults spend most of their sleep time. It's a non-REM sleep, and I'll talk about REM sleep later. We spend about 60% of our time there. The brain starts to consolidate the memories, and it chucks out what you don't need, the short-term stuff, what you have for dinner or whatever. It doesn't necessarily keep all that stuff. Stage 3 moves us into the deep sleep. Now, I want to have this caveat here. Some models say there's 4 stages of sleep. Some say there's 3 stages of sleep, with 3 combining. I went ahead and just combined 3 and 4 together for, consolidation reasons. So it's a little faster. All right, stage 3, we're going to call it 3 and 4, is REM. It's a transition between REM and non-REM and REM sleep. and because we're consolidating it into what's called paralytic sleep, or our deepest sleep cycle. This is the most important sleep cycle that we have for brain regeneration, for cognitive regeneration. All right, science is learning so much more about this because it's one of these areas that we really don't understand 100%. We're still trying to learn more about it. But they have sleep scientists have discovered that there are really cool things that happen in these stages, and that's why they're important. I'm going to get to that in a minute. Stage 3 sleep is where we lose about 20% of our synapses. So these memories that are not useful are gone. They just get dumped, and this reduction allows us to have a clear cognition the next day. Without this reduction, known as synaptic homeostasis, synapses could become overloaded and burned out. So we see this in people who are sleep deprived. They have very poor cognitive skills. They can't think clearly. They make really poor decisions. And if you go long enough without sleep, it can be fatal. Stage 3 and 4 is where our brain physically shrinks, and I think this is really cool because this was discovered around 2018 using functional MRIs, and they found that the brain shrinks about a millimeter, and these channels that are around the brain open up, and our cerebrospinal fluid goes in and actually flushes out the brain. People who don't get that sleep, they get this buildup of these beta amyloid plaques. And that's what is believed to cause Alzheimer's, dementia, that whole umbrella of neurologic illnesses that happen later in life. A person's sleep time can be thought of as two halves. The first half for a majority of people consists mostly of stages 2 and 3. That's where you are. You're jumping back and forth, all right? Sometimes you go into a stage 1. If your bladder fills up or whatever, your brain will kick you into a stage 1 sleep, let you know your bladder's knocking at the door so you don't wet yourself. As the night progresses, though, as you get deeper into sleep, stage 3 begins to diminish in quantity, while stages 1 and 2 get to lengthening, with periods of REM occurring in between. REM sleep, our rapid eye movement, is where we have vivid dreams. Now, you can and we do dream in every single stage. Okay, I just covered that. You can have dreams in light sleep, you can have dreams in paralytic sleep. Both of those can cause us to have some terrifying dreams. Hypnagogic or hypnopompic hallucinations, we can have that going on in those stages. Average person dreams 4 to 5 times per night, but rarely recalls the dreams. I've had a number of clients tell me over the years, I don't dream. Yeah, you do. You just don't remember your dreams. If a person's awakened during the REM cycle, they're likely to recall the dream, and that's the key there. If you get awakened for some reason, then that's what it is. A lot of times when you're getting ready to get up in the morning, when your cycles are ending and you hit that last REM, you're getting ready to wake up, and that's why sometimes you'll recall those early morning dreams. In addition, a person awakened during REM will suffer from extended sleepiness. And that's pretty common too. If you get awakened in stage 1 sleep, for example, you didn't think you were sleeping. If you get awakened during stage 3 or 4 sleep, it takes you a moment to figure out what's going on because your brain's not quite present, okay? During REM sleep, and this is actually during REM and or / paralytic sleep, our bodies induce muscle paralysis. This is so we don't injure ourselves or our bedmates while we're trying to act out our dreams. Muscle paralysis does not occur at any other stage, which is why we can toss and turn, speak, and have other body movements during non-REM sleep cycles. This is where we can have what I call hypnopompic hallucinations, where you are having this dream, you're paralyzed, you can't move, you're trying to scream, you can't scream, you're trying to punch an attacker, you can't punch the attacker. It seems very, very real to you. And this is where we get, I have clients tell me that a dark man at the end of the bed. It was always a dark figure at the end of the bed, and we get alien abductions and things like that. These typically are caused by hypnopompic or hypnagogic hallucinations, and the person's trying to justify what happened to them because it doesn't make sense. REM sleep takes between 90 and 120 minutes of sleep time. The brain waves during REM are very similar to the brain waves in wakefulness. So that's why these dreams can seem so real, because It's the same frequency, if you will. You're not really, your brain's not doing anything different. The transition from REM to stage 1 sleep is where some people experience hypnopompic hallucinations. And that's what I was talking about earlier, where again, you're coming out of this dream, you're starting to wake up, but your brain's not quite there and it hasn't figured out what's reality, what's dream, and these can be very terrifying. In the REM period, breathing becomes more rapid, irregular, and shallow, eyes jerk rapidly, and limb muscles are temporarily paralyzed. Brainwaves during this stage increase to levels experienced when a person is awake. Also, heart rate increases, blood pressure rises, males develop erections, and the body loses some of the ability to regulate its temperature. And it might be why you see your partner, your bed partner, throwing off the sheets or pulling the sheets and blanket over them because they're getting hot and cold. So now some of this may start to make sense. All right, sleep disorders. Sleeping problems can affect our physical, mental, and emotional health, both short and long term. Sleeping problems can potentially be fatal, okay? Please understand that I'm saying this with 100% truthfulness. If you have certain sleep issues, they can be fatal, and you need to get these checked out. And I'm going to talk about that in a little bit. Sleep problems include insomnia, sleep apnea, restless leg syndrome, hypersomnia, which is narcolepsy, parasomnia, which is sleepwalking, and circadian rhythm problems. The symptoms of sleep disorders depend on the specific disorder. Some signs that you may have a sleep disorder include you regularly take more than 30 minutes each night to fall asleep. You regularly wake up throughout the night. You have trouble falling asleep. You have trouble staying asleep. You get up too early in the morning. You often feel sleepy during the day. You take frequent naps or fall asleep at the wrong time during the day. Your bed partner says that when you sleep, you snore loudly, snort, gasp, make choking sounds, or stop breathing for short periods of time. If this is happening to you, please hear me. Go get a sleep study now. Call your doctor now. Tell them your partner says this stuff. They need to get you in. These are symptoms of sleep apnea. They can be severe and it can be fatal, okay? All right, you have creeping, tingling, crawling feelings in your arms and legs which are relieved by moving or massaging them. Restless leg syndrome. So, not fatal, but you need to get it checked out. Your bed partner notices that your legs or arms jerk, often during sleep. You have vivid dreamlike experiences while falling asleep or dozing. So again, if you're having these hypnopompic or hypnagogic hallucinations and they're consistent and you have them a lot and they're disrupting your sleep cycles, you need to go see a sleep specialist. You have episodes of sudden muscle weakness when you're angry or fearful or when you laugh, and you feel as though you cannot move when you first wake up. So if you get stuck in a paralytic sleep and you're waking up and you can't get going, you need to go see a sleep specialist, most likely a neurologist in that case. All right, if you're suffering from any of these issues or if your sleep is severely disrupted, seek treatment from a medical provider experienced in sleep disorders. Sleep disorders have a variety of causes, including mental illness, medication, stress, alcohol, stimulant, drugs. There's a lot. I didn't even list all of this. As humans age, our sleep patterns become more disrupted and irregular. They also spend less time in deep and REM sleep and are more easily awakened. If you think about it, your grandparents or great-grandparents may be asleep by 6, 7, 8 o'clock at night, but they may be up at 2, 3, 4 a.m. And this is pretty common. Conversely, teenagers may go to sleep at 11, 12 o'clock at night, 1 a.m. in the morning, whenever, and they may sleep until 3 or 4 or 5 in the afternoon. So, babies sleep about 22 hours a day, newborns, at first. And then once they realize they can really jack up their parents' sleep cycles, they decide to do that. All right, sleep hygiene. Sleep hygiene is the process of getting your sleep to be perfect or near perfect. All right, and yes, it is possible. All right. If you do all the things on this list that I'm going to list here, and you really truly give it a shot, it shouldn't take more than about 3 weeks for you to get into a good sleep cycle. All right. Black out your bedroom. Light intrusion will keep you awake, will wake you up during the night, will keep you from falling asleep even. Remove or unplug all electronics that are not medically necessary. I'm going to explain more about that in a minute. Use your bed for sex and sleep only. Do not eat, read, watch TV, play video games. Don't do anything in your bed other than sex or sleep. You want to train your brain to recognize that the bed is for sleeping. You want to train your brain that the chair is for sitting and reading and playing video games and whatever. Your brain can differentiate that if you train it that way. But if you use your bed as a chair or a dining room table, your brain doesn't know any better. All right? Pull your headboard 6 inches off the wall. So we know that if there's water lines or if there's power lines in the wall, in or around our bed, that they put off these low electromagnetic pulses, and that definitely interferes with our brain waves during our sleep. It has a potential to keep you from staying asleep. So when I get clients that say they have trouble staying asleep, they wake up multiple times throughout the night, it's one of the first things we start to look at. What are the electronics in your room? Are they on a power switch that completely shuts off? Do you unplug them? Or are you just turning them off? Because computers, any modern electronics have what's called vampiric voltage that they pull, and that puts off an EM pulse. So if these things are not unplugged or on a power strip that's completely shut off, then you can still get that EM interference, and that can cause problems. So I've had clients say, hey, I took the TV out of the bedroom, I took the video games out of the bedroom, now I'm sleeping like a baby. All right. Be consistent. Go to bed same time every night, get up same time every day. And there's about a 1 hour variance, so if you have something going on, you stay up a little later, or get up a little earlier, you'll be okay. One of the reasons I really, truly hate the time changes twice a year because it just messes with sleep, and you can see it. I think people are grouchy for about 3 weeks after those time changes. All right, shut down your cell phone, tablets, laptops, all the stuff that puts off a blue light, and about 2 or 3 hours before you go to sleep. The light from your cell phone or from these tablets is the same it's on the same wavelength as the sun, and so obviously if it's bright outside, your brain's not wanting to go to sleep. It wants to do stuff and be active. So we put those things away a couple hours before we go to sleep to kind of give your brain a chance to say, okay, it's time to wind down and go to sleep. Avoid high sugar, caffeine, heavy foods 2 to 4 hours before sleep. I personally go to sleep at 10 every night, and I will not eat anything after 8 p.m. So, all right, some studies show that having your bed in a north-south alignment it can improve sleep. These were not peer-reviewed, so I don't really push that one so much. But if you're having trouble sleeping, check your bed alignment. If it's east-west, maybe flip it north-south, see if that helps. Exercise has been shown to improve sleep, and studies indicate that the time of exercise is not a factor. So there was this belief for a long time that you shouldn't exercise right before you go to bed because you get your heart rate up, you get your metabolism up. But these studies are showing that that's not true. That's not the case. You can exercise, you get your shower, you go to bed, and you should be able to go to sleep. All right, issues falling asleep. This is one thing that I ran across quite a bit as a counselor. Most clients come in and say, it's one of the questions I ask, do you have trouble falling or staying asleep? And they tell me I have trouble with falling asleep, I have trouble with staying asleep, I have trouble with both. And so it gives me an idea of where to go with that, and if it's part of a potential mental disorder or if it's a medical issue that they need to seek out a specialist for. As mentioned before, our brain is quite active during stage 1. Some people struggle to quiet the mind and move through the cycles. Meditation is beneficial in correcting issues falling asleep. So if you look at some of my other videos, one of them is on, several of them have meditation in there. So if you go through them, you'll see there's meditation techniques. I found that if you meditate about 10 minutes before you go to sleep, you can get your mind calmed down enough to when your head hits that pillow, or if you're meditating in bed, that's fine too. When you close your eyes, meditate, you'll find your brain can calm down pretty quickly. If you are meditating the way I taught in the other videos, you're visualizing something that's bringing you peace, that's making you happy, it's joyful, it's calming you down. Some people can't do that. Their brain just is going a million miles an hour and they're jumping to different things. So I like the 10 count method. What you do is you'll count your breaths in your head to 10. 1, 2, all the way to 10. If or when your brain goes to something else, you pop up that visual stop sign. Stop. I'm going to sleep. You tell your brain, I'm going to sleep. We're going to sleep. Then you start over at 1 again. And so we start at 1 and we go back to 10. We get to 10, we start at 1. If the brain shifts, we stop. We go back to 1 again. Issues staying asleep. I talked about this before with the EM pulses. That can be an issue, staying asleep, not having your room blacked out, having some light intrusion. So if those things are taken care of, then you need to look at these things. Stress is usually the main culprit for trouble falling and staying asleep. If you use stress reduction techniques and get your stress under control, and I'm a huge fan of mindfulness. I didn't put it on this slide, but mindfulness, if you're in this moment, you're here, you're now, you're present, there's no stress in this moment, and there's no stress in this moment. Stress is caused by thinking about the past or the future, or focusing on the past or the future. So it's not in this moment. Exercise 30 minutes 5 times a week for good mental health. Actually, the 30 minutes you can do 3 times a week and you'll get good mental health. You're basically going to exercise enough to burn up cortisol. Poor nutrition can play a role in our ability to process stress. If you eat junk, it's that garbage in, garbage out. So if you're eating junk and junk food, fast food, highly processed or ultra processed foods, yeah, your body's trying to fight off that junk, and it's not really able to help with other things. So keep that in mind. Nutrition is, I might just do a whole lesson on nutrition because it's very important for our overall mental and physical health. All right. Talk about your stress to a trusted friend or colleague or your therapist. Obviously, that's what we're here for. So, and meditate regularly throughout the day to alleviate mental stress. I know in the last video I talked about the books Pieces Every Step, Pieces Every Breath. Reading those books, implementing what the author Thich Nhat Hanh talks about in those books is it's very enlightening, and it's very lightening as well to lighten your stress levels. All right, I did this, now what? So I have clients that on occasion, it's pretty rare, they'd come back to me, we'd see, I've followed up week after week after week. They're 3, 4, 5, 6 weeks in. They swear they're doing everything and they're still not getting the sleep that they need. So sometimes the sleep issues a person has runs deeper than simple stress. If you work really hard to have great sleep hygiene but are plagued with sleep issues, you need to seek out a specialist. I don't recommend over-the-counter sleep aids. I encourage you to talk to the sleep specialist, the neurologist, or whoever your primary care is going to send you to before you start taking drugs. Some of these over-the-counter meds and even some of these prescription meds have some really nasty side effects. All right. I hope you enjoyed this lesson. I'm going to put up the references that I used on this. You can check it out yourself. And if you want to dig into it further, hope you like and subscribe, and I will see you next week.